If your doctor suspects pancreatic cancer based on your signs and symptoms, he or she may order some tests to confirm the diagnosis, and these may include blood tests, imaging scan, endoscopic tests, and tissue biopsy. But for people without symptoms, screening for pancreatic cancer is currently not recommended. In people with certain inherited genetic syndrome or history of familial pancreatic cancer, they are considered to be at higher risk for pancreatic cancer, and they may be eligible for certain screening tests, such as MRI or endoscopic ultrasound. There are currently no accurate validated blood tests for the diagnosis of pancreatic cancer. Most of the time, pancreatic cancer does not show up on blood tests. And the blood tests that you would normally do at your family doctor's office, they look for relatively non-specific things like liver function tests. And certainly pancreatic cancer can cause some abnormalities in liver function tests, and this can happen because a tumor may have spread to the liver, or in some cases, it blocks up the drainage of the bile duct. However, many conditions can cause similar abnormalities, and most of the time that doesn't mean a pancreatic cancer is present. But once a pancreatic cancer is diagnosed by imaging, your doctor may order blood tests for specific tumor markers that are shed by pancreatic cancer cells. And these tumor markers are CA99 or CDA level, which stands for carcinoembryonic antigen. Now, none of these tumor markers is accurate enough to tell for sure if someone has pancreatic cancer, because some people with pancreatic cancer do not have elevated levels of these tumor markers, but some people who don't have pancreatic cancer might have high levels of these tumor markers for other reasons. And still, the tumor markers can sometimes be very helpful along with other tests in figuring out if someone has pancreatic cancer or not. And in people already known to have pancreatic cancer or who have high tumor marker levels to begin with, these levels can be measured over time to help determine how well the treatment is working. If all of the cancer has been removed, these tests can also be done to look for signs the cancer may be coming back. If you have unexplained abdominal pain or jaundice, an abdominal ultrasound might be one of the first imaging tests done because ultrasound is easy to do, it doesn't expose you to radiation. Ultrasound can be very helpful in ruling out gallbladder or liver conditions that can cause similar symptoms as pancreatic cancer. But if you have signs and symptoms that are more likely to be caused by pancreatic cancer, a CT scan is often more useful. So a CT scan uses X-ray to make detailed cross-sectional images of the body, and CT scans are often used to diagnose pancreatic cancer because they can show the pancreas very clearly. They can also show if the cancer has spread to other organs and lymph nodes. A CT scan is also very helpful in determining if surgery might be a good treatment option. If a CT scan is inconclusive, or if your doctor wants better images of the pancreas, an MRI can be used. Unlike CT, MRI do not use radiation. Instead, MRI uses magnetic fields and radio waves to make detailed images of the pancreas. So tumors that are not visible on CT scan sometimes would appear on MRI scan. Endoscopic ultrasound, or EUS in short, is one of the most useful imaging studies for diagnosing and staging pancreatic cancer. And EUS is a type of endoscopic procedure. This involves insertion of a flexible tube into the mouth, down the stomach, and into the first part of the small intestine. At the tip of the tube is a small ultrasound probe that transmits sound waves. These sound waves then bounce off the surrounding structures such as pancreas, bile duct, and liver, and are then captured by the probe and converted to ultrasound images. Because the pancreas sits right next to the stomach and small intestine, EUS allows the physician to get very detailed images of the pancreas. Many studies have shown that EUS is better than abdominal ultrasound, CT, or MRI in finding small pancreatic tumors that are less than 3 centimeters in size. But the biggest advantages of EUS is that Unlike CT or MRI, biopsies of the tumor can be easily and safely obtained at the time of the procedure. These biopsies, often referred to as fine needle biopsy or fine needle aspiration, can allow your doctors to make a definitive diagnosis of the cancer. During EUS, we pass a small needle down the scope directly into the tumor to take a biopsy. Because this is done under ultrasound guidance, EUS is considered a safe procedure with low complication rates. There is another endoscopic procedure called ERCP, which stands for endoscopic retrograde cholangiopancreatography. This can also be done to diagnose pancreatic cancer. However, this test is not recommended solely as a diagnostic test because it carries a higher risk for serious complications than other imaging tests. ERCP is often used as a therapeutic procedure to relieve blockage of the bile duct caused by pancreatic cancer. During ERCP, a tube is passed down the mouth into the small intestine, where a small catheter is inserted into the bile ducts. Dye is then injected and x-rays are taken. The x-ray will show where the blockage is in the bile duct. A small sample can be taken from the bile duct to confirm the diagnosis. A stent, which is a small tube, can also be placed in the bile duct to relieve the blockage. Now, as I said, because of potential for serious complications, ERCP should be reserved for therapeutic indications.